One's going to be trouble because it's hard to tell you why your cycles are irregular. This comment came from one of my videos about your cycle in 60 seconds, and that's for a regular cycle. Now, when we're talking irregular, this could be from a lot of different things. Now, if you just got your period recently and you're having a regular cycle, that's really normal. So there's likely nothing wrong with that unless they're noticeable that something is wrong. Like you're having really bad cramps or you're bleeding really, really heavy and things like that. If it's a bit irregular, that's normal. And it normally regulates about 2 years after, all the way up to 5 until you get into your peak fertile years. Another thing can be stress. Stress can cause irregular cycles. And this stress could be from traveling, from being sick, not eating enough, eating too much. If you are exercising not enough, exercising too much, have a nutritional deficiency. Celiac disease can be another one. If you have a gut imbalance, this can throw off your hormones. Not getting enough sleep. If you have different challenges like PCOS or endometriosis. If you have a thyroid problem, hypothyroid or hyperthyroid can both cause irregular cycles. And blood sugar dysregulation. Now, what is actually happening when you have irregular cycles? Now, a lot of times people will be my cycles is between 20 days or 40 days. And a lot of the times those 20-day cycles are just a breakthrough bleeding or a withdrawal bleeding. And you don't actually ovulate. See, a true period comes after ovulation. So a lot of times with these irregular cycles, what's happening is you're working up to ovulate, and for some reason we're just failing to ovulate, or that egg is not maturing. So we're gonna recruit another cohort of eggs and we're gonna try again. And we're gonna keep trying until we do ovulate, and then from there you'll get your period about 2 weeks after. And sometimes we can notice that our cycles are getting increasingly more irregular until they might just stop altogether. Now, the ceasing of the cycles can be called hypothalamic amenorrhea, and this can be really common with extreme amounts of stress, nutritional deficiencies, and eating disorders. Now, what if your cycle is getting shorter and shorter and shorter? Now, again, it could seem like your period is coming sooner and sooner when you might just be having a withdrawal bleed and not ovulating. But if it is actually, in fact, your period coming sooner and sooner, you're going to want to figure out why that is. Now, this can be normal as you approach menopause, but if it is happening too soon, this could signal another problem. So how do you track irregular cycles? I've had irregular cycles forever. They got a lot more regular, and I'm definitely ovulating way more frequently. But if I have bouts of stress and things like that, they get more irregular again. So what I do is track my cervical mucus and my temperature, and I go over that in other videos. Keep in mind that I'm talking about cycles that are off hormonal birth control and are naturally cycling.